am Dr. Aref Hussain, senior physician and cardiologist practicing for last 30 years at Ikon Hospital and the Pacific Hospital, Aurangabad, Maharashtra. Today I am going to discuss a very important clinical condition so called as myocardial infarction. In common words, it is heart attack. Why this is important? Because nowadays you might have seen that our life is really very fast, very much changing, and everybody is working right and left. Nobody is taking care of their health issue as such. And this is the condition which is being observed that most of the time is related with the stress, related with the family problems, and of course the other issues like hypertension, diabetes, high cholesterol levels, smoking, and the disturbed dietary pattern, disturbed sleep pattern. So what is myocardial infarction or what is heart attack? We know that our heart, which is pumping right and left throughout 24 hours and throughout our life, it itself requires the blood for its functions. And the blood which is supplied to the heart is by the vessels, so called as coronary vessels. It's just like a pipeline which has been given to the heart by nature to supply the proper blood for its working, and our heart requires the energy in the form of glucose, in the form of oxygen most importantly. If anything is going wrong with this supply, our heart faces some problem in terms of its working or the beating property, and some rhythm disorders also. This is labeled as heart attack. Why this heart attack? How this occurs? Why it is important? There are many factors which leads to a heart attack or say myocardial infarction. To simplify this subject again better, let us see how it can be. See, in our kitchen or in our house, there is a pipeline. And if this pipeline has to be clear enough so that whatever the waste, whatever the things which are there, they should go out. But if suppose for some reasons, whatever the supply which is coming to that particular area is getting blocked by some mechanical block or something causing compression or blocking, then that leads to insufficient supply or insufficient wastage excreta to the other sides. Similarly, the story in the heart. Our heart is having supply, blood supply, and that is through the coronary vessels. If this coronary vessels, which is supplying to the heart, gets blocked because of fat accumulation, because of its narrowing, the lodging of the various particles, the fat particles, the platelets, the fibrin-rich amount, and that leads to blockage of the vessels, and ultimately the supply which was supposed to go to the heart gets lessened, and the patient feels something going wrong with the heart, and it is experienced in forms of either a chest discomfort. This chest discomfort can be in the retrointestinal area, it can be in the epigastric region, it can be transmitted to the arms or to the jaws also. And this is seen most often with the patients, those who are already having hypertension, diabetes, like if they are smokers, if there is a strong family history of coronary artery disease, or diabetes, or hypertension, or they are smokers, or if they are drinking alcohol to a more excessive levels, or if they are taking undue medicines for simpler reasons, then it leads to a blockage of the vessel, the cardiac vessels or the coronary vessels, and ultimately patient goes for the heart attack. Now, if any patient, how to recognize this condition? Any patient who comes with history of, suppose if you are the witness to a patient who is suffering from heart attack, how to recognize that someone is having heart attack or a myocardial infarction? This is very simple. If suppose someone who is already in a hypertensive or having a problem of diabetes or other risk factors says that he's getting discomfort in the chest area, and this discomfort he describes that he's getting for the first time in his life, such as an excruciating pain, that is something is heavy weight is put over his heart, or something is compressing over his heart, a sort of choking sensation, a sort of a heavy weight as if it is put over his heart, leading to a sense of impending towards death. That's an heart attack. And if it is lasting for a pretty longer time, say maybe somewhere around more than 15 to 30 minutes, it's a sign that patient is suffering from a myocardial infarction or a heart attack. The first and the foremost thing which has been described or has come from the various studies, the time. It is said that the time is the muscle, or muscle is the time. If you succeed in getting all the things possible enough in the first 10 minutes of this heart attack, then I think much of the job is being done. And this is through by proper recognition. The moment you see that somebody is telling like this, that he's getting a discomfort, immediately call for some help. And if you have something available in your at home in the form of aspirin, 2 tablets of aspirin of 150 milligram, that comprises 300 milligram of aspirin, you just crush it and give it to the patient immediately. And if a nearby hospital is available, transfer this patient to the nearby hospital where a good physician is available, or if a cardiologist facilities are available, you can go to that center, but everything should be fast enough. The physician recognizes by the symptoms, he takes the ECG, he recognizes the condition by taking the ECG, and he gives certain medications which are very important for the patient in the first 10 minutes, and then followed by a half an hour and an hour. The immediate action. So he will give the tablets in the form of aspirin, clopidogrel in the dose of 300 milligram, or now the newer the antiplatelet drugs or blood thinner drugs are available, like prasugrel in the dose of 40 milligram, or ticagrelor in the dose of 180 milligram. That can be given, and ECG is taken. Now the patient is there, and if the patient's relatives are there, you are going to counsel the patient and the patient's relatives regarding the severity of the illness, regarding the nature of the illness. You are going to tell to the patient's relatives that, see, this is a medical emergency, patient needs urgent help, we have given already the necessary medications. Now the options are being told to the patient's relatives, that the type of therapy which is being available for the management of myocardial infarction. And this therapy is in the form of injectables like thrombolytics. Why they are called thrombolytics? Because they dislodge the clot which is being there in the vessels. Or rather, the modern therapy is in the form of primary angioplasty, where the patient is being taken to the cardiac cath lab, and immediately the vessels are screened, and if the blockage has been found, the plasty is being done, the vessels are being opened mechanically. So whatever the clot or whatever the blockage is there gets open within minutes and within hours of the condition, and the immediate supply is regained, and the heart muscle will once again start functioning properly. This is a very important thing, and this decision making of either giving the injectables or going for the primary PCA or primary angioplasty has to be very much substantial, and you should see that whatever decisions you are making is for the betterment of the patient, for his future. So this is how these 2 important modalities are there. Now, after being taken care of either in the form of injectables or in the form of angioplasty, what remains is how we're going to make the patient's life more comfortable in near future. This is by the rehabilitation process, and this is by the proper attention towards the patient. You are going to tell to the patient that, see, God has saved your life. We are there to support you. You got the relief in time. Now you are going to change the life, and it is called as lifestyle modification. Lifestyle modification carries much more importance in the future outcome of a heart attack. What is that? Lifestyle modification comprises of your day-to-day activities, your diet, your exercise, your the job issues, then proper exercise training, and the compliance towards medications or the regularity of the medications, regular visits to the doctor, to the cardiologist, to the physician, if you have an extensive lifestyle modification, that your disciplined life, you are going to plan everything of yours, your office work, your job, your medicines, your everything, then I think much of the job has been done. So in heart attack, what we have seen in modern medications, that if you diagnose the condition early, if you give the thrombolytics early, if you plan for the angioplasty early, I think major has been done, and of course followed by proper lifestyle modification will help a lot to the patient and especially to his family, and ultimately for the myocardial infarction or heart attack is that nowadays there is no age constraint for the heart attack to get it. It can occur at quite a younger age, and it can be at the age of 25, it can be at the age of 35, or even in the other ages also. And there is no, here lies the importance of knowing the condition properly, diagnosing the condition properly, treating the condition properly in time, and saving the life is the key factor in managing the myocardial infarction or heart attack. Now, the risk factors which are involved with the heart attack are: number one, your lifestyle; number two, like tobacco chewing, smoking, uncontrolled diabetes, uncontrolled hypertension, modest or severe increment in the alcohol use. That all these factors leads to the more and more future complications and more and more development of heart attacks. So we have to take care of all these things. So with these few remarks about the myocardial infarction, I think everybody of us will take care of this important condition. And one more important thing which I must tell at this juncture is various misconceptions about the knowing this problem. Majority of the times it has been observed, even I myself have seen, that patients coming to the hospitals or just ignoring themselves, that if we get any discomfort in the abdomen, in the epigastric region, or sort of some sensation in the retroesternal area, they feel that it is because of acidity or hyperacidity. It is not like that. Majority of the time it has been observed that this condition of myocardial infarction or heart attack was just missed because the patient has interpreted it very wrongly, and even the doctors have interpreted it very wrongly, considering it to be hyperacidity or some other problem related with his diet and with his stress. But mind it well, before labeling anybody to have a hyperacidity or any other the GI problems, think twice, thrice that you are not missing a diagnosis of myocardial infarction or heart attack because you are going to save someone's life by your proper diagnosis. This is a very important message I must tell you. And second most important thing, the compliance, the necessity of taking the medicines, necessity of changing the lifestyle, and necessity of making the awareness about this disease, not only in your family, but in your neighbors and in the social areas. With this, I conclude this session and telling that, life is a precious thing which God has given to you. Just value it and make it valuable for the others also. Thank you so much.